What side effects do pancreatic endocrine medications cause? Imagine your pancreas as a tiny but mighty organ that helps control your blood sugar and hormone balance. When it needs help, doctors prescribe medications to support its endocrine functions. But like all medicines, these can have side effects. Let's explore what they are and why they happen. One common medication is pancrealipase, which helps people with pancreatic insufficiency digest food better. Some people might experience mild effects like headaches, coughs, sore throats, dizziness, or feeling full quickly after eating. Gas, irritation around the anus, or itching can also occur. While these are usually manageable, more serious reactions can happen. These include rashes, hives, difficulty breathing or swallowing, hoarseness, nausea, vomiting, diarrhea, stomach pain, bloating, constipation, or joint pain, especially in the big toe. These serious effects may indicate allergic reactions or inflammation and requiring prompt medical attention. Another group includes drugs called GLP-1 receptor agonists, such as exenatide and liraglutide. They mimic natural hormones to stimulate insulin releases in diabetes management. Common side effects are gastrointestinal, like nausea, vomiting, diarrhea, and stomach pain. Some people might notice injection site reactions, headaches, or cold-like symptoms. There has been concern about these drugs possibly increasing the risk of pancreatitis or pancreatic cancer, but current scientific evidence does not conclusively show a higher risk. Severe dehydration from gastrointestinal symptoms can lead to kidney issues, so monitoring is important. Tirzepatide is a newer medication that targets to hormones to help control blood sugar. Its side effects often include nausea, diarrhea, loss of appetite, stomach discomfort, and bloating. Less frequently, people might experience difficulty breathing, swelling of the face or throat, rapid heartbeat, or jaundice, which is yellowing of the skin or eyes. Dizziness, blurred vision, depression, and fatigue have also been reported, and these symptoms should be evaluated by a healthcare professional. For those undergoing islet cell transplantation, medications are used to prevent rejection of the new cells. These immune-suppressing drugs can increase the risk of infections and certain cancers. Common side effects include nausea, fatigue, anemia, diarrhea, and abdominal pain. There is also a risk of liver damage during the transplant process and the development of antibodies that could affect future transplants. When considering pancreas health and the risk of pancreatic cancer, it's important to note that some medications like GLP-1 receptor agonists and DPP for inhibitors have been examined for possible links to pancreatitis and pancreatic cancer. However, current research shows that these risks are not definitively increased when the drugs are used properly under medical supervision. Patients with a history of pancreatic issues should have personalized risk assessments before starting these medications. Remember, side effects can vary from person to person, and not everyone will experience them. If you notice any new or worsening symptoms while taking these medications, consult your healthcare provider promptly. They can help weigh the benefits and risks and adjust your treatment plan to keep your pancreas healthy and functioning well. Always follow medical advice and never hesitate to ask questions about your treatment options.